They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HS St. Anthony's Memorial Hospital.
Hi, thank you so much for joining us today for this episode of Being Well. I'm your host, Keanne Armstrong, and today we're going to be talking about all things heart-related. And I have Dr. Mehta and Dr. Wiarda, both from Carle, Cardiologists, and they're joining me today to talk about heart issues and new advances and all kinds of things introducing heart problems and what we can do about them. So thank you so much for joining me today.
Thank you for having us here.
Thank you for coming. So let's get a little introduction here. Tell me who you are, what you do, and what your role is.
So I'm, again, Dr. Karen Wiarda. I'm a non-invasive cardiologist here in Mattoon. I do outreach cardiology, and my focus is on clinical and testing. And we have cardiac rehab in our office. So I do a lot of the imaging, like echoes, stress tests, cardiac rehab, which is exercise, either general exercise or exercise after a cardiac procedure, like a stent or bypass or valve replacement. We do that in our office, and then of course Holter monitors to evaluate for rhythm problems and EKGs.
Okay, and you, Dr. Mehta?
I am an interventional cardiologist. I practice out mainly in Champaign, but this is my outreach area, so I come and like to see patients here so they don't have to travel. And we offer a variety of things at Carle at the main campus. And being an invasive guy, we do patients with heart attack patients, try to fix them. If they have a heart attack, try to open up the vessel. If somebody needs a bypass surgery, we get our surgeons on board. And we have started doing a lot of new things in the last couple of years. We have started putting new valves for patients who are elderly, so they don't need surgery. They don't need to go for open heart surgery. They can be done through the groin approach. And people stay in for a day and then they go home. We have recently started doing appendage closure device, which is for patients who have irregular heartbeat. So if they are at a risk of bleeding, we can put this device and they don't need blood thinners for a long term. Besides, we have other procedures which are going on to close the hole in the heart. And in future, a lot of new exciting things are coming at Carle. So I'm very happy to help our patient population. We all do clinical, we see them in the office, and reasonably well, I think we try to help as much as possible. And we don't like sending patients out unless they have a real need. We send them to tertiary and a higher level centers for a second opinion.
All right. Well, it sounds like there's lots of things that we get to discuss today, and I'm glad that you're here because heart problems are something that seems pretty common these days that a lot of folks are dealing with. What are some major causes for heart problems for women and men, and are they similar or are they different? Let's talk about that a little bit.
So the most common causes for having heart problems are diabetes, high blood pressure, high cholesterol, smoking, and excessive alcohol use, and being overweight or, more importantly, obese. So weight certainly plays a role as well. So those are really the risk factors that are common for everyone. And those are all fixable risk factors. The one risk factor where you really can't change, but you can make changes to improve the risk is genetics. So if your parents or your siblings or your grandparents have heart disease, then certainly you're at risk. So really, the genetics apply to every aspect of heart disease, and honestly, a lot of the other diagnoses as well. But a lot of lifestyle changes can really have an impact.
Okay.
I think more or less the risk factors are quite similar for males as well as females, but it's mainly sometimes the presentation. When they have risk factors, when they have heart disease, the presenting symptoms are a little different in women. So we hear all the time that most of the time women will say they are not feeling well. Mm-hmm. They may not have the classic symptoms, but if they have the risk factors, we always tell them to get an opinion from a physician and get it taken care, because that could be the only symptom of not feeling well, and you could be still having a heart attack. We have a lot of male population who always comes with chest pain. They have discomfort in the arms, they have discomfort going to the jaws, they have sweating, shortness of breath. Women may present with that. However, there is a certain group who never complain anything, and their just symptom is fatigue or tiredness. And we still like, if they have risk factors like Dr. Wiarda just mentioned, then we would still like them to be checked out.
Okay. So when you say classic symptoms, those are some of the classic symptoms that folks should pay attention to?
Correct. We always say that usually if somebody has not had any discomfort in the chest before, and that is the first symptom, chest pain, shortness of breath, or discomfort going to the neck, sometimes on the jaw, and sometimes on the back. I think these are the real classic symptoms. People should really get a checkup done. If they have not had those symptoms, better get it checked with a primary care, and then can take an opinion from a cardiologist.
Okay. Now, how prevalent are heart problems in our region? We live here in the Midwest. Is there a distinctive factor across the United States where people live, maybe their health choices, the food they're eating, different things like that contribute to health problems, distinguishing our region from others?
So certainly obesity is an epidemic in this country, which increases the risk of all the risk factors that I spoke about. So it increases the risk of diabetes and high blood pressure, high cholesterol. It also increases the risk of sleep apnea, and all these things increase overall risk. We're also too sedentary, and so we have too much processed food. And so just simple changes like changing your diet, having less processed food, more fresh vegetables, more fresh fruit, less junk food, less fast food, and preparing your own food at home as much as possible can make a tremendous impact. The other thing that is critically important is exercise. Not smoking, which is of course a huge risk factor, limiting alcohol. These things can have a tremendous impact.
Since you mentioned that, not smoking, what is it that about smoking that is so crucial to heart problems? What does it do?
It actually disrupts the vasculature or the vessels of the heart, the vessels of the legs, the vessels of the brain, and it can make plaques cause. So if you already have a plaque in the artery, it can actually cause the plaque to be ruptured and cause a heart attack. So there's stable angina or heart disease, and there's unstable heart disease, and it's the unstable heart disease that causes the significant heart attacks.
Right, and like she said, sometimes it increases the blood coagulability, so it makes the blood a little thicker, tends to stick around, and that's how the plaque starts building up, and it can make the plaque a little softer. So when you're doing a strenuous activity, those plaque suddenly open up and the blood clots over it, and it triggers heart attack. It makes the small vessels of the leg become diffusely diseased, and people can get problems in the leg, walking. Just like the heart attack, you can get trouble in the legs, you can get stroke. So interestingly, all these risk factors, they affect the whole vasculature, not just the heart. Can affect the arteries in the neck, causing stroke, can affect blood flow in the leg arteries, causing peripheral vascular disease and amputation eventually. So smoking is a very big risk factor.
Okay. You also mentioned obesity, and it's a struggle for a lot of folks to change the way they're eating and to change their healthy lifestyle, and to do different things and get up and move. What are some tips, or how do you encourage folks to make that change and to know what to do? And also be careful, because I think some people are scared, like, well, what if I exercise? Am I going to be pushing myself too far? What are some things that you talk to people about in making a lifestyle change?
So I think, first of all, it's really important to have a very in-depth conversation of where you're at now, what you're comfortable doing, and sort of what your ultimate goals are. And when you look at obesity, it's more than just people eat too much or they exercise too little, because fat is actually an organ, and fat does what it can to keep itself going. And when you have fat cells, it's not so much the number of cells, it's actually the quality of the cells, and the cells actually start growing, and it just causes a lot of metabolic problems. So then you have issues with not being sort of satiated, or when you eat, you just don't feel like you feel like you just want to eat more and you don't want to stop eating, and you're always hungry. So when you're diabetic, you have insulin resistance, and when you have obesity, you have what's called leptin resistance. And so in issues with another hormone called ghrelin. So those hormones actually make you always hungry, never feeling satiated. So it's important to really make changes to your diet and changes to your activity. And one of the things that's the most important is just do it slowly and do it what's most comfortable for you. So in terms of exercise, even just walking can have a tremendous impact for patients. So even just going on a walk every night, and you don't have to start walking 3 miles, you start walking a block, and if you're comfortable, you keep going, but always try to just do a little bit more. And if you have any symptoms of significant chest pain, or dizziness, or lightheadedness, or shortness of breath that feels out of proportion to the fact that you're beginning to exercise, then you should seek help before starting an exercise program or before continuing that exercise program.
Right.
And go ahead. Sorry.
And just like she said, it has become an epidemic. And with all newly available gadgets, we see it right from school days now. Obesity has become a big problem, and there should be real public awareness made that it's good to watch media all the time, but people should be active. Otherwise, that's the reason we see nowadays heart disease occurring at a younger age. Previously, we still have certain group of population in town here that they are 80s, 90s, they are still fine and healthy. And we see the other extreme who are 35, 40s presenting with all kind of medical history and medical problems. And it's not even genetics, but sometimes you can those factors are modifiable. That's why they always said in the past that get off the couch, don't be a couch potato.
Right. Yeah,
Right?
It's not good. Even though we're a TV station here, we offer PBS Kids programming, and we say, don't sit and watch TV all day. It's not good for you, but take what you've learned and go do something with it,
That's right.
and get active, and that's what we try to educate people on. So I'm glad that we're getting that awareness out.
And it's interesting because of course there's lots of technology. I love my Fitbit. There's apps. There's things to help you, but I think the most important thing is actually just education. A lot of people truly don't know what healthy food is, and so you need to talk to your doctor or meet with a dietitian and actually understand ways that you can help. When you go to the grocery store, shop the periphery, hit the vegetables, hit the fruits, and everything in the middle is actually more for you to that's usually not healthy. So shop that periphery.
Yeah.
And Fitbits are nice because they just make you accountable, and they make you look at your steps and say, move more. One of my med school teachers said, look at everything as an opportunity for movement. And that's my husband and I's mantra, and it's true. Just move as much as you can, get off the couch. And even if it's walking, and if it's going to the gym, if you have joint problems, go join a pool. Even if you just walk the pool, you're still exercising.
Yeah, that sounds good. Some of the wearable trackers these days, like you mentioned, Fitbit, some different things like that, maybe some of the older folks aren't sure how to utilize that type of equipment. Maybe some of the younger population will. Do you encourage people to use those types of things to track what they're eating, to track their fitness and things like that? Is there a difference in the age and what people are using and what they're not these days?
I think, like I said, most of the digital devices nowadays, they have apps. You can, it tells you and reminds you that it's time to get up from the bed or get up and do some exercise. You can enter your calorie count, what you're eating, a lot of things with the apps. You can scan on what you're buying from the store. So buying healthy, getting off the couch, doing regular exercise, all these things can be easily monitored. You don't need an expensive gadget. These are all from the same newer phones, smartphones, you can get all this thing done.
Okay. Something that I think is interesting, when you go into the produce section, you see all these different types of fruits and vegetables, but when you start tracking and looking into them, some of them do have a lot of sugar and some of them have more carbohydrates than what you would normally think about.
The difference is if you have a sugar and a carbohydrate in a fruit versus that same sugar and carbohydrate in a cookie, you're doing much better having all the fruit. Yeah. The single best food you can eat in terms of just straight antioxidants are actually berries. Blueberries are incredibly healthy.
Oh,
but
good
whole
to know.
grains.
Love berries.
whole grains, whole wheat pastas, whole grain bread, and then fruits, plenty of fruits and vegetables, and then limiting meat, limiting fat. Okay. But if you are going to have healthy fats like olive oil or avocados, healthier fats.
Yeah, and just keep yourself mindful of those things.
Exactly
There's lots of things out there to help keep you that way.
That's exactly right.
So let's talk about some treatment options that are available, both minimally invasive as well as, like full-blown surgeries. Let's talk about some of the things that both of you do for patients.
So I think it depends on how the patient presents to you. The minimal invasive, the catheterization is the simple step we do. Previously, we used to do it through the groin. Nowadays, we do it from the hand. We call it the radial approach. You put a small little local anesthetic, go with a catheter inside. If the patient has come with a heart attack, take pictures of the heart artery, put a stent, and the procedure gets done in 45 minutes. And patient gets off the table and can sit up immediately. Previously, we used to do this from the groin, but now this has become very comfortable, and we have seen significant reduction in bleeding. So this is the current standard of care. All these procedures for heart attack and checking of the arteries are done from the hand. Then if we find a blockage, we put a stent, we balloon them, and if sometimes there is significant amount of blockage all over, then we refer them for bypass surgery. We also do different kind of procedures for elderly population living in this area who have got valve problems. As we get older, 1/3 of the population will get narrowing of the heart valve, and previously there was only open heart surgery. Nowadays we can get this done through the groin, and people come in. We had patients last week 95, but if they are sharp, they are fully active, and there is a family to take care of them, we bring them, we put a new valve, next day they are out.
That's amazing.
So this has remarkably improved the care for the elderlies, and as technology keeps on coming, new and new interesting things are coming, so that people don't have to stay in the hospital, the morbidity is less, the infection rate goes down, and they're out of the hospital next day.
That sounds great. Do you have anything you'd like to add to that as well?
I think from a non-invasive perspective, clearly if people need stents and they need valves, then we're sending them there. Our goal, of course, is attempt to make lifestyle changes always. That's the first attempt for any approach. And then, of course, medicines can make people feel significantly better, improve blood pressures, improve cholesterol levels. But then we do testing, so echocardiograms to look at the structure of the heart, to look at the chamber sizes, the chamber thickness, and to look whether or not there's leaky valves, things like that. So that gives us a lot of information structurally about the heart, as well as hemodynamically, or how the impact of blood pressures are on the heart. And then stress testing, of course, we can do in multiple different ways, just a treadmill versus a chemical stress test, one that involves echocardiogram and one that involves nuclear, where we're looking to see the perfusion of the blood and whether or not it's equally perfused, or if it's not perfusing equally, and if it looks like there's been a heart attack versus maybe blockage that we can fix with a stent.
Okay.
Right, and a lot of new things are coming for even heart failure patients, where you know that you have tried medications, you have tried stents, you have tried bypass surgery, they have bad heart function. We have pacemakers, we have defibrillators, and there are newer defibrillators which tries to resynchronize the whole heart, which also tends to improve the heart function. And our heart failure doctors are managing the patient. There are a lot of newer medications coming out.
Exciting.
And we are having a new heart surgeon joining us shortly, who is going to be an expert in putting an assist device, so people can be out of the hospital rather than staying in the hospital all the time.
Okay, that's good news. So there's lots of good things coming down, lots of good things that you're doing now that may not be, I guess, as scary, to some folks, and maybe they're thinking, well, this isn't so bad. I can get in, I can get out, and I can feel better quicker. So that's good to know.
Yes.
I wanted to ask you about some at-home tracking or monitoring. What should people be doing at home If they're concerned about heart issues, if they have heart issues, what are some things that they can do at home?
I think first of all, it's really important to know your numbers. So you should always know your cholesterol number. You should always know your blood sugar, or if you're diabetic, your hemoglobin A1C, which looks at the average blood sugar over 3 months. It's important to know your blood pressure. It's even important to know your heartbeat. I think it's important to even know how to take a pulse to see does it feel regular or irregular, especially if you're feeling bad. So I think having a blood pressure cuff at home and documenting your blood pressures and bringing them into the physician, it's always helpful for them to make decisions, because when you go to the office, you have a snapshot. And some people have what's called white coat hypertension, so their blood pressure is high because they're in the doctor's office and they're nervous, but then if they go home, it's good, or vice versa. Sometimes people actually have a great blood pressure in the doctor's office, and then they go home and it's actually quite high, and they're not understanding why they have symptoms when they're walking, but it could be that their blood pressure is going really high, or they have atrial fibrillation or extra beats called premature ventricular contractions.
Are there
So
trackers? Are there trackers for folks who do have AFib? Because you hear about that these days.
Yes, so this all the newer devices which comes out, and obviously we have heard on TV about Apple, which has come out with its monitoring system. There were other systems which would take 1 or 2 leads at a time. Usually it's only 1 lead, but it records your heart rhythm. And if you have some palpitation, you can look at it, and if you see that is not regular, you can talk to your doctor. And they have studies and which have shown that there's a little long way to go, but it really helps to pick up what kind of arrhythmias you're having. We also give patients when they come, which is a multi-lead, which records much more, and we give it to our patients to take it home. But on day-to-day, a wristwatch, you can have that gadget, which will tell you the heart rate. There are newer things which are coming out which will be sensing your blood pressure. Eventually they are going to come out for blood sugar also. So a lot of new technology is coming out. It's still a year out, but many more things to come out.
Okay. Well, we've got about 2 or 3 minutes left, and I wanted to ask about what if folks are not going to the doctor? Are heart problems always life-threatening? Do they need, what is something that you can tell people right now who may be watching, if you are concerned you have a heart problem, what do they do? What's the first steps that they should do?
We usually say, first, if you have a symptom which you have never had in your life before, if you have those symptoms, first always go to the nearby hospital or call 911. That's the first thing to do. If you already have a history of heart disease, talk to your doctor during the day, but if the symptoms are worsening, don't waste time. Call 911, go to the hospital. And always, like Dr. Wiarda just said, take a blood pressure at home. Check your weight at home, check your blood sugar at home. So when you're talking to the doctor's office or an ambulance person, you've already given them some information. It saves time.
Okay. Would you like to add on to that?
I think it's just really important to get your annual physicals, to make sure that, again, that you're discussing any symptoms of concern with your doctor. You can always call the doctor's office and certainly make follow-up appointments, but it's really important to follow regularly with a physician.
Okay, sounds good. Well, I think that we've covered a lot of topics. Is there anything that we haven't covered that you'd like to get out to the viewers right now?
Well, if you really feel that you're having some problem, don't waste time. Call us.
Time is of the essence.
Time is money. That's very important.
Yeah, absolutely. Anything else you'd
Do
like to add?
Do yourself a favor, eat healthy, keep moving,
Yep.
and look for every opportunity for movement.
That sounds good. Well, I appreciate both of you
Thank
being
you
on
very
today.
much.
Thank you again for
Thanks.
being here. Thank you. And thank you for tuning in for this episode of Being Well, and we'll see you next week.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HS St. Anthony's Memorial Hospital.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.